All right then. Good morning, afternoon, and evening, everyone. Thank you all for joining us today for our webinar on driving health equity through digital innovations in maternal healthcare. My name is Rhoda Robinson. I am the Executive Director for HACI. HACI is a development organization that is focused on improving the health and productivity of underserved populations in Nigeria, particularly women and young people. And our work covers the aspects of rights, health rights, digital technology, and working with communities, governments, institutions, private sector, and technology firms to develop and implement innovative solutions that address current challenges in our society today. And we've been working over the last 17 years across more than 20 states in Nigeria and across Africa in other countries for different projects to ensure that, one, we are able to create a holistic solution for the various challenges that we see in today's society. Today's session, we'll be looking at how digital technology can drive better healthcare, better maternal healthcare, and how we can use the available resources that we have, especially in underserved communities, where we have a high rate of maternal mortality, and how we can use limited resources and incorporate digital technology into them to ensure that we are able to improve the quality of care available and accessible to women in local communities. So to start off with, I'll be introducing our panelists. We have three panelists who will hopefully be able to join us today. And the first that we'll be starting off with is Dr. Keith Hanner. Dr. Keith Hanner is the founder and CEO of IPRD Solutions, an advanced research and software development and deployment group focused on delivering advanced healthcare technology and solutions to LMICs, primarily in Africa, including in Nigeria, where they've been working for the past 5 years. Thank you, Keith, for joining us.
Oh, delighted to be here, Rhoda.
All right. So
Thank you.
just to give a bit of background on what we're talking about now, Nigeria currently contributes to, is one of the countries that contributes to the highest mortality rates globally, with over 500 deaths per 100,000 live births, according to the World Bank report of 2023. And we are looking at how we can develop an impact-driven, sustainable system that can be scalable, especially with our current resources and current environment, and how these solutions can, or this system can provide real-time data to enhance evidence-based policy and decision-making, to improve on the quality of care that is available in our primary and secondary healthcare facilities, especially in facilities that are in remote regions and that serve the most poor and the most in need, and also looking at how we can connect this underserved communities and underserved people to more advanced and more developed healthcare services, especially when we're looking at secondary healthcare facilities and tertiary health facilities within the more urban and developed parts of different communities. So I would like to start with this question to Dr. Hannon. Like, looking at the current landscape of maternal mortality and maternal health in Nigeria, and the history you've had and working in Nigeria and similar countries such as Thailand and India, could you share an overview of what this looked like and how digital health solutions are able to bring about some of the biggest challenge, address some of the biggest challenges, and bring about some of the biggest impact that we need in our society today?
Sure. Well, thank you, Rhoda, again. So, yeah, so let's talk about that. And all those locations that you mentioned, Rhoda, so India and Indonesia, actually another one, and also Nigeria. So paper records have been the norm. And it's amazing how resilient they are. But what does that tell us? It tells us the importance of the longitudinal health record. So for a long time, people believe it's very important to keep track of patients and monitor over time. Now, many attempts have been tried at digital solutions, and many were taking sort of large computers and putting them into these environments, but really that has not worked out due to the cost, the maintenance, the training, and it's a very naive sort of approach. And then I would say in the past 10 years ago, big rise of cell phones, and there were a lot of mHealth, mobile health solutions, but a lot of fragmentation, and I'll go into that a little bit more. But really, yes, there are some nice little verticals that sort of work on particular pieces of maternal health, but they're not everywhere, and they don't communicate with other systems, other parts of the government, for example. So if we take a look at what people like us have been doing, we have been focusing on things like scalability and sustainability. So, and I think in the last 3-4 years, I think there's been a lot of progress there. And so I can quickly rattle through some things, but standards. So digital standards, very important. And there has been DHIS2, and some of the listeners on this would recognize that. But DHIS2 is really an aggregation data standard, meaning it's not patient-centric. And getting back to the paper record, it's very patient-centric. It's particularly looking at the record of that patient in particular. Have they been to their visits? If not, bring them back. So DHIS2 is an averaging type of standard. So we've been really proposing, and really the earliest, I would say, introduction of FHIR in Africa back in 2018, the FHIR standard, FHIR, and fast healthcare interoperability, what that stands for. And really, there's a lot of coalescing around that. So a lot of people agreeing that it's very good for clinicians and it's very good for technical people, meaning clinicians, it serves the purpose of getting the clinical record, fairly simple, straightforward, and accessible. And for technical people, it's actually quite easy to implement. And a key thing there is that if you develop software in FHIR standards, then it will communicate. So machine-to-machine interface. It means you can build on things and add capabilities like large language models that are coming along, QR codes, as we're using in Oyo and Ocean State, and a variety of other techniques. And so basically, landscape in digital and maternal health in the digital space, I think, is progressing. Robustness of communication is very important. In all these locations, then connectivity is very poor, and that really needs to be managed well, so that just like in WhatsApp, I think everyone here has used WhatsApp and how reliable that is, even in low communication areas. Well, those are the capabilities that we've been developing, are now coming to be standard. And all of these things very important for robust longitudinal health record, just to get back to the first point I was making. So maybe I'll pause there. And yeah.
Thank you so much, Keith. And I'll thank you so much. Like you had also touched on the importance of healthcare being patient-centric. And I would like to go to and introduce our next panelist, Dr. Muideen Babatunde Olatunji, who is the Executive Secretary of the Oyo State Primary Healthcare Board and a seasoned public healthcare professional and technocrat. Thank you for joining us, Dr. Olatunji. Can you hear us? Hello,
Thank
Dr.
you.
Olatunji.
I'm happy to be here.
Okay.
Thank you.
Yeah.
I can hear you, but the network is fluctuating.
All right.
You.
Okay. Thank you so much, sir. So I'd like to pick up from where Dr. Hannan stopped and just ask that, in your experience leading the primary healthcare board, what digital health innovations are currently making an impact, especially considering the low resource setting, and what are the best practices that we can see in designing some of these tools that can and will prioritize patient-centric healthcare?
Well, thank you. Good afternoon, everybody. My pleasure to join you. Let me make an apology ahead of time. I'm on the road and the network seems to be unstable, so I might be in and off. Just try and bear with me. Like Riley said, in primary healthcare setting, which is the lowest rungs of the ladder in the healthcare service delivery in the country, we are trying to build and be resilient on the structure that we have, and how can we have a qualitative healthcare service delivery. And we are actually leveraging on any willing partners that have the wherewithal to help us take edge to the next level. What we do basically is to focus so much on capacity building for the frontline healthcare providers. And unfortunately, we resource limited, like you said. We have human resource gap, but the enormity of the job to be done is so much. And what we can do is to make sure that the staff are exposed to modern training, current realities, and things that can actually make health service delivery worthwhile. We are trying to be innovative when it comes to technology and keep pace with new technological development and advancement. So the healthcare worker by day are actually leveraging on the new technology and using those that can actually store data, maybe in the cloud, and when you have upgrade, and when you are not likely to be linked to the network, and you can actually have your data stored in the cloud and you can have it to retrieve. We work basically on long times with paper data, but now gradually we are moving on to electronic data management, and people are actually taking lead from this. We are taking lead in this. So we believe that by more support that we get and more capability is what we are actually going to be able to do and being in pace with the new reality. So basically, that is our focus, and that's what we're thinking about now. Thank you.
Thank you so much, sir. And before I jump back to Dr. Hannah, you had mentioned the importance of building the capacity of healthcare workers, especially when it comes to digital health transformation and actually improving the quality of healthcare that is provided at the primary healthcare level. Now, could you share a bit about what the steps that are necessary to actually achieve this, especially when it comes to digital skills for healthcare workers, and how we are able to sustain this impact over a long term? Because when we look at the challenges and opportunities that exist in implementing digital capacity building initiatives, how can we ensure that we're able to support these initiatives for the longer term?
Thank you. I think AC Initiative have been a very collaborative and willing partner as far as this one is concerned. We've been able to do resource mapping. We've been able to do human resource mapping as well. And we're able to identify a kind of a gap analysis to know what we actually need, where we ought to be. And AC Initiatives have been a willing partner that actually build our capacity as much as possible in this line. So what we focusing on now, perhaps the gadgets that we can actually utilize. Currently, we use hand headsets that we can actually use to collect most of this data. Another challenge that we want to be able to scale above is to how to sync most of the data we can collect in isolation and sync them with the national data, for instance, HIS2, and so that we don't need to rework the system again. So what we think that will be much more beneficial now is when we can actually cross-link most of these data tool with the existing backbone that we have in the country, which is the HIS2, and the staff that will be trained will be specifically identified. Initially, we might be focusing on the data manager, the health management officer. But now we want to expand to the frontline healthcare providers as well. That we don't really need to make it an isolation like an empire, that only one person able to do such a thing. We want to be something that be polyvalent for every person to be able to work with data, transmit data, and translate data and use data for action. These are the things I think we can do now. So any willing partner that wishes for our capacity in this line and give us the required infrastructure, logistics to back up to make it work, going to be a welcoming agenda for us in the States. Thank you.
Thank you so much, sir. And I completely agree with you on the fact that we need to expand the coverage of the healthcare workers that we are building the capacities, because it's not just healthcare workers that deal with data that are responsible for the total outlook of healthcare, but those who actually provide the healthcare to the women in the facilities need to understand and receive that skill so that they are able to translate what they're doing into data that is usable at all levels, especially at the state and national level. And that will bring me back to you, Dr. Hannan. When you had mentioned the use of the FHIR fire system and its ability to connect and work with different technologies. And Dr. Olatunji had mentioned the importance of being able to link data collected in isolated regions to the larger pool, so it's accessible. Now, in your experience and in your perspective, especially with the different programs that you've been working on in Nigeria, how do we see this playing along, especially when it comes to ensuring that we are able to support and sustain continuum of care so that data collected in one region is accessible and is usable if in another region for the purpose of improving healthcare?
It's a great point. And so fully agree that that's necessary. And I think it's worth mentioning, I think it was Dr. Salami who advised us on a program for essentially trying to reduce malaria in infants. And it wasn't just one vertical. It was a combination of malaria nets, ensuring that a pregnant woman had a malaria net, that they had picked it up at a distribution center, that they were getting IPT treatment in the clinic, and that they were coming back on their regular schedule. And if you look at all those are different campaigns funded differently. And if you ask Dr. Salami, and if you ask me or Rhoda, I believe all of us here, it's a combination of all those things. And so there is a need to connect those, and not just connected in a well-connected town, Abuja or like that, also in the periphery. And so we've developed capabilities, QR code type technologies, for example, that basically allows data to be transferred between these different campaigns. And the same technology we use to link data from paper records to digital, since paper is still mandated, and it can't just be you can't think of a digital solution today in the absence of paper. It's very unfair on the workers to just simply say switch over to brand new system and forget paper. That's just impossible to do, because there are mandates and various things. So I think addressing those and helping workers rather than just pushing a solution, digital solution on them, is critical. And linking these different bits of data across these different verticals and from different geographies, very important. And I think a lot of progress has been made there.
Okay, thank you so much. Before I go into the next question, I just want to say to all our participants, please feel free to drop your questions in the chat box, and we'll try as much as possible to take the questions by the panelists. So please, if you have any questions or have any contribution, please drop them in the chat, and then we'll read them out later. So I'll still stay on you, Dr. Hannan, and you had mentioned the importance of did paper trail and paper records on how that kind of solidifies or shows the patient-centric care that is given. I wanted to ask that what are the essential steps in implementing a data system that not only captures those records and it makes it human, but you can also use this record in making decisions at the state or the national level? How do we go about translating that in a sense that we are not excluding or sidelining the healthcare workers that have not fully transitioned into the digital space?
Sure. No, that's right. It's a great question. So I think there's like a core set of infrastructure capabilities. I've mentioned a few, such as the FAR standards and reusability of software. So everything is not a reinvention every time there's a new thing. The dashboards and easy to use dashboards. So there's a set of and the robustness of communication. Now, so those things have been missing in the past. That I would say is like a baseline. But to answer your question directly, for workers who are kind of new to digital space, there's emerging capabilities such as LLMs, large language models, which are really, and I'm a technologist, but even for me, they're quite amazing. The ability to interact with people, and we've done a fair amount of work. And let me describe some use cases there. So, for example, summarizing in just narrative text the patient record. So, for example, in any sort of digital system, typically there's a range of blood pressures, temperatures from the last, if you're pregnant, the last, trimester, 2 trimesters, whatever it is. And LLMs, rather than having to try and poke around on a digital device, LLMs are very good at taking that data and summarizing it. And now this is not making a diagnostic, this is not replacing the worker, but it's for, to your point, Rhoda, for workers who are not as digitally adept, there's a very simple, short summary that can tell them about the patient in front of them. So that's a different way of using that digital record. And you can contrast that to reading all the jots down on the bits of paper, trying to understand the story behind the patient. So I think that one is a very exciting one. And even that can be done remotely on phones these days. So there's a good example for field workers. Another use case there is advising them on what to do. You've got a patient unknown, but perhaps with some symptoms, and the field worker is not quite used to the digital capability, and but they can enter in a few things, and then basically AI can begin to nudge the behavior of the field worker to perhaps suggest that the person comes into the clinic, and here's why. So there's a range. I think it's intriguing that I think one of the biggest impacts of LLMs is actually essentially uplifting the skill set of the digital skill set of workers, not necessarily the healthcare skill set, but the digital skill set, and making it easier to basically work with these tools. So I think we're at an interesting time for 2 reasons. One is the infrastructure capability of digital. It's the next generation, I would say, with all these new technical capabilities. And then innovations such as LLMs coming really very mature now. So,
Thank you so much, Dr. Hannon. I'd like to, based on everything that you've said and the possible applications for LLM technology and other similar technologies that can be used to improve the provision of healthcare, especially in the maternal health space. I'd like to come back to you, Dr. Olatunji, and ask, what areas are we missing? Like right now, We've seen technology being used in patient record management. We've seen technology being used when it comes to telemedicine, albeit sometimes it doesn't work in some regions. But what areas that do we currently have that we have gaps in that technology can make a difference, but we are yet to utilize it properly in those areas?
Well, thank you. Can you hear me?
Yes, sir.
Yes, yes.
Okay, thank you. Now, well, I quite aligned with everything Dr. Anand had said, and I think it made a lot of sense. Now, a little bit of area whereby there might be gaps, like everybody should know that knowledge is ever expanding, opportunity is expanding as well. In the area of maternal health, that we can actually leverage technology now. If we look at the angle whereby we have the health education for pregnant women, the routine thing that we do now in our traditional setting of medicine is for them to come for antenatal clinics, and you give them health talks, and you expect to change their attitude and practice and their preparedness toward pregnancy and delivery are the things we want to focus attention on. Now, you want to be able to juxtapose this between the physical access or attendance in the clinic to have a routine checkup of the client and the information that you give them. So maybe now we can reduce the waiting time or the clinic time that they will be spending if you can provide information. But another challenge is this: not everybody is lettered. If you are able to tell them now that we are providing information online for you, we provide all education and awareness information for them. Not all actually read and write and actually leverage on that. It's only for the elite. But if everybody has the opportunity to read and write, is another area that I think we can leverage on and be able to expand the management of nursing mothers. Then again, the scheduling of the clinics can actually be strengthened on the backbone of technology by giving them the time they need to come for physical clinics when they need to be in attendance. Apart from the fact that you put it in their file or in their records on their visit cards that they can come and so date, a constant reminder can actually pop up on their phone as an SMS or as a kind of a unique alarm system that will ring on the day that is supposed to go to the clinic. Instead of giving SMS message, maybe there's a kind of app that will be installed in their phone that it will sing a common song or an information that would directly link with the needs to come for antenatal clinics. And this will go a long way in ensuring that we have compliance and improve clinic attendance, thereby reducing the incidence or prevalence of maternal mortality and morbidity, because they get closer to you'll be able to indirectly increase access to health, and thereby the constant tab or monitoring on the pregnant mothers can be ensured through this platform if we can expand even to the extent of even infant welfare clinics. Same approach can be adopted. Just something that will make people to be able to be aware they need to be in the clinic and be able to access care. I think these are one of the things we can actually focus attention on. Thank you.
Thank you very much, sir. Thank you very much. Before I go on to our final questions, I don't know, Dr. Hannah, if you want to just respond to that question as well on where you think we can further apply the same, because for instance, I think we've had a lot of discussions on how technology can also be used in managing supply chain, especially for drugs and life-saving medication for pregnant women as well, and being able to actually manage this system such that we reduce the number of stockouts that facilities have, and they're able to continuously provide the care that they need without having to wait long time before they have the necessary materials and things that they need to continue care. So any added contribution to this as well?
Sure, that's right. And I would just like to just agree on the concepts of using SMSs and also audio. We've actually done some early work on exactly that, just listening to conversations. Actually, Rhoda was involved in that too, and helped or organize some of that. And so that is quite exciting for removing the requirement to read and write, and that really the dialogue improves enormously. But yes, regarding stockouts, one of the wonderful things about having sort of reliable infrastructure is that basic capabilities of keeping track in real time of the status of RDT strips and IPT supplies, that begins to get you know, kind of, I'm not going to say easy, but much easier in the periphery. And ironically, there are a lot of supply chain systems, but they're all geared for the kind of at the very high end, meaning at the sort of warehouse type level, shall we say. But a lot of the actual issues where it meets the patient, that's the problem. And there's a lot more of those places than a warehouse. And so simply by having these, what I call real-time data streams, that's really one of the big emergence with the ability to sync at least once a week. That's the only requirement we typically advise the healthcare workers is please just sync up your phone once a week. And in that way, all these little threads of real-time data streams get synchronized, there's aggregation, and then just rudimentary stock taking can then highlight where there are about to be stockouts. And it doesn't take too much prediction capability, AI, very simple prediction to say that a stockout is going to be coming. So now we haven't put all those in place. We're looking for the ability to do that just from a funding viewpoint, but we've got all the pieces for that, and we would be super excited to be able to put all that in place and build on the infrastructure that's there.
Okay. Thank you so much. We have one question in the chat box, and it says, do you find that practitioners are hesitant to use new technologies? Are there any concerns, for example, related to privacy? So I'd like both Dr. Hannah and Dr. Olatunji to respond to this before we round up.
Let's see, Dr. Olatunji, do you want to go first? Or I can go first. Rhoda?
Dr. Olatunji? Okay.
Hello, sorry, my network was fluctuating. Sorry, the limitation that we might be, thanks to Dr. Na for the concession. Now, the limitation that we might be having now is the coverage for connectivity. When it comes to the internet network, it doesn't seem to cover every space where we operate. True, like I mentioned, the required logistics to be able to apply most of these tools and be able to put them to use. We are in a resource-limited environment, and it's not something that's easily available across boards. Then again, of importance is the issue of the required knowledge that is needed to be able to apply most of these things. And that's what I talk about capacity building and knowledge expansion all the time, so that people can actually know how to apply most of this technology and information. Then again, you have a challenge with electricity supply in this part of the world, whereby the regular power supply is not something that you can actually guarantee and take to bank to be sure that you can have seamless operation when it comes to technology or the tool that you might be using. So putting all this together, you see that we are in a very serious resource limited environment. We need a lot of backbone ingenuity to be able to keep pace with the advancing world. Thank you.
Thank you very much. Dr. Hannah?
Yes, and that's right. Just to respond to the privacy thing, yes. So definitely the way that a good way to address that we found is to engage the stakeholders from the start. So a lot of concerns about privacy is usually due to not understanding what is being stored and where it's being stored. And so very good to early on work with the healthcare workers to describe exactly that. So what are they entering? Where is the patient data going? And the answer is it's held inside the country, not removed from the country. And there are authorized logins and various things like that. There are now fairly robust compliance in Nigeria. It's NDPR, Nigeria Data Protection. Yes, NDPR. And so there are fairly standard sort of processes that organizations like ourselves go through. And so that's very helpful in terms of managing healthcare workers' concerns about privacy. Yeah.
Okay. Thank you very much, Dr. Hannah, and thank you very much, Dr. Olatunji. So for our final question before we round up this session, I would just like to ask, like, from both of you, like, what do you think the next 10 years would look like with response to the future of technology and maternal health care?
Thank
Dr.
you.
Hannah? Okay, Dr. Olatunji first, yes.
Okay, thank you very much. Well, the only thing that is constant in life is change. And from the look of things now, anybody that doesn't seem to tag along or keep pace with the ever advancing technology will surely be left behind by the advancing technology. In the next few years, talking about, rest assured that the core management of mental health in the country will be definitely technical driven. And from what we seem to be seeing now and the new paradigm shift that we're having in our thinking, we are rest assured that we will not be where we are today. In the next 10 years, technology will have replaced some of the old ways of doing things. We will have been able to use technology to improve on access to care and be able to improve the patient care. Most of the technological environment will be patient-centered. That will help us in the reduction of the maternal and child death in the country. And we even lessen the burden of workload on the health workers in general. And inadvertently might be able to improve efficiency and be able to improve their proficiency as well. And inadvertently, there will be elongation of average lifespan for average health worker because technology will have removed some of the burden that we have now and be able to make things better for us. So it's a kind of ever expanding field and with full of opportunities, challenges and zones waiting to be conquered. And we know as a country, definitely we are tagging on, learning on what we have now, and keeping pace with the new knowledge that we have now. So I can see a greater country in the next few years. Thank you, and God bless you.
Thank you very much, sir. Dr. Hannah?
Yes, it's a great question. 10 years, what will happen? So I think there's going to be 3 steps. One is what I would call a core step. And what is that? That is taking all that next generation set of digital capabilities, basically what we developed, and then proving it in a larger area, proving the impact. And we're beginning to see that in the more rural areas. There's a great increase in traffic of people because the digital capabilities lifts the kind of skill of the healthcare worker in terms of keeping records and such like. So that's, I think, an exciting first step. And then a second step is, building enough infrastructure, and by that might mean power, could be solar, but generally getting the connectivity, the basic bare minimum needed for scalability in digital world. And then the third step is bringing in these advanced technologies such as LLMs at scale. So I think in the next 10 years, I think we're going to see build outs in these 3 areas. I think it's an exciting time for maternal health. Yeah.
Thank you so much. As we round up, I want to say a big thank you to our speakers, Dr. Muhyiddin Babatunde Olatunji, the Executive Secretary of the Oyo State Primary Healthcare Board, and Dr. Keith Hanna, founder and CEO of IPRD Solutions, for joining us today and sharing in your wealth of knowledge and experience on how we can better use digital innovations to improve maternal health care. And as you've said, we're looking forward to the expansion and the growth of digital technology to address more challenges and more limitations that we are seeing in our health systems, to ensure that we are able to get a society where access to healthcare is accessible, especially in the hard to reach communities, and the quality of healthcare is also improved. Thank you all for joining us and listening in, and for your questions as well. Please know that this session would also be available as a recording, so you can always come back to it later on the platform. And thank you to the Global Health Landscape Symposium organizers for giving us this opportunity to talk with you all and bring this very important topic to the space. Thank you all, and do enjoy the rest of the symposium. Bye, everyone.
Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you.
I've been here.